Sciences Hub Wales. And Rhodri's going to take Ifan's sort of overview and that initial framing and begin to introduce some of the work that he and colleagues have been involved in looking at aspects of innovation in NHS Wales. Rhodri, over to you. Thank you.
Thanks very much, Rick. So it's always difficult to follow Ifan, I'm sure. So I'm in a dead slot in a way to have to do that. But yes, an inspiring talk from Ifan, and thank you to Rick and Gareth for inviting me along today. So yeah, there's the challenge that you mentioned on here to help element. So I guess from the life sciences hub perspective, it is the message that we are here to help. We are directed from Ifan's team at Welsh Governments to do that and to be helping on the front line and bringing people together, etc. So if we move on to the next slide, what I'm going to try and do, and quite quickly, is give a bit of an overview, so a bit of a hush-bash, as we call it in Welsh, or a bit of an advertisement of what we do at the Life Sciences Hub, just in case people aren't aware, but also to follow on from Ifan on some specific areas maybe of just throwing some things in really of some areas where the Challenge Fund and where people are beginning to think of challenges put forward, some themes or some areas which are key. Just to entice, it's not to direct. I've got no monopoly on ideas at all here, but it's just to start the conversation as we go into the breakout rooms, etc. later on. If we move on to the next one, please. So in terms of the Life Sciences Hub strategic aims, but they are common, I'm sure, across the CCR to all our organisations and certainly across government as well. And I'm sure we're all committed to these three and how interconnected they are. But what we're about is improving the health and well-being outcomes for people in Wales. You know, this is fundamental to our sort of nation's prosperity as well. A healthier nation is a more prosperous nation, and this interlinking between health and wealth is just something that should be second nature to our psyche and to our thinking, really. And it's creating those connections that is key to delivering in those elements. But it's also about improving the efficiency and the value within the health, and also, and I will emphasise right throughout this, the health and social care system, but also I'll touch that is wider in its definition now as well, beyond the NHS and social care providers. But by looking at social determinants, etc., it is the public sector and the private sector as a whole from across a number of sectors coming together. And that's a key element that will follow on in a second. But thirdly, it's this element of how do we use the models and the ecosystems that we have within Wales to deliver both on the health element, but also to drive the economic development, which Ifan was touching on there. You know, we can use our ecosystem, our strengths, the opportunities to really drive economic value whilst we're improving our health as well. We've got a fantastic ecosystem, we've got fantastic strengths, but this bringing together with a strong vision, a common language and a common ambition is where we will really succeed and drive things forward. So those, I think, are aims from within the hub, but I'm sure they could be widely disseminated and shared across as well. So next slide, please. So just on a very high level, what does the hub do? Well, the four elements that I'll go into a bit more detail in a second. So it's very much convening partners. So this is how we're delighted to be aligned and working with CCR as well. This is about bringing together people, but not across, as I said, the NHS, but it's also across social care, but it's industry, academia, but also looking at, you know, health in terms of perspectives of bringing people like housing associations together, different industries. One of the key things that we saw within COVID response were companies which would not consider life sciences as their core business coming together. So digital companies which may not think life sciences, engineering companies on PPE production. Health, life sciences is not, as Ifan was saying, your pharmaceutical type model before, or even the people focusing on diagnostics and in the laboratory today, but it's spanning right across the whole industry and the whole ecosystem, but with a focus on life sciences as a key area which represents global and enormous opportunities. In orchestrating the system, it is trying to work again across to seeing how the system improves, because there's a lot of work to be done in putting the systems in place to allow these convenings and getting people together. But in particular, it's about accelerating opportunities. You know, on one end of the spectrum, we can look that the NHS is under enormous pressure and will have some resources this year, but beyond is certainly the resource element is going to become even more challenging. So delivering quickly, expeditiously, and accelerating the current opportunities is enormously important, but it is a competitive sphere. Life sciences as well, if you look at it in a more holistic way, is a global arena. So building quickly, getting into these markets, developing, it is a race. It is a race to the top. Although we've got strengths, many other parts of the globe do as well. So we've got to recognize that, find our niches, build on them, and accelerate the opportunities quickly. But it's also building for the future. So it really is concentrating on the cultural elements, putting the structures in place, thinking longer term. You know, only thinking of today and the opportunities of today is always, you know, a weakness. We've got to look one step beyond and figure out what are the systems, what are the platforms, what are the connections that need to be in place to allow to put us in a competitive place to build for the future. So that's a very, very broad sort of brushstroke of key elements. But it's, if we go to the next slide, it's possibly putting some bit more meat on the flavour here. So if you can just flick through the bullet points rather than go through them. So if you just whack them all up in one go, that'll make life easier. Thanks very much. We've touched on that engagement between industry, health and academia. This is part of the Challenge Fund here now. It's bringing these elements together. But as I say, industry, do not think of it as just life science in the traditional sense. This sector is appealing and can bring together a whole myriad of different industry sectors to focus on life sciences. The health is both health and social care. We have enormous strengths, as Ifan said there, and a track record. And let's celebrate. You know, it's a huge thank you that we should always give to the NHS. It's invented in Wales, let's remember. But a system still that is held in the highest esteem around the globe. Companies want to work with the NHS. It is sometimes very difficult to work with the NHS. Part of our role is making that easier. But companies on a global basis recognise the strengths that the NHS offer. And as Ifan mentioned, in our universities, there are enormous strengths. But bringing these elements together is where we will succeed. And that's part of the role that we do through meetings, events, whatever way we can do it. To succeed, Ifan mentioned as well the bigging up Wales. Success follows success. If we look at places like Ireland, Sweden, etc., we recognise the success of these places. We're quite good at hiding our success under a bushel in Wales. We need to get better on really building the profile and pushing that out and showing that confidence, as Ifan aspires to do now. Just very quickly, in terms of the system from within the NHS, what we've looked at is how we deliver some specific services to accelerate elements. So if it's looking at funding bids, so it's providing support to colleagues within the NHS on how to get them to be more competitive to succeed at a UK level. There's a lot of the money now in life sciences through the strategy, etc., is going to come through London, and we need to improve the record within Wales of getting our fair share of that funding coming through. But it's also supporting business cases. You know, clinicians, etc., within the NHS are fantastically busy and focus quite rightly on patient support and care and treatment. So giving them the opportunities and the space and the supports to drive forward business cases, but also the horizon scanning element, looking to the outside world, what's happening, learning, copying, taking this best, putting it into the Welsh system, improving on it. It's all the type of elements that we're involved with. And then it's, again, just flying through this, the system change element, whereas we deliver a number of projects, and I could go on about some inward investment projects that are huge that are happening at the moment, right down to getting companies in Wales into the NHS. Whilst we can deliver projects, a lot of this is about system change and making it easier in the future, so that this integrated system of industry being able to work with the NHS, with universities, becomes simpler, smarter, more efficient as we go forward. So next slide, please. In terms of the how, and these are suggestions in terms of impact areas, these are very, very wide, but these are ours, but they fit in with what just Ifan mentioned there. The digital and AI is an absolute enormous area. We do have strengths within Wales, but there are enormous opportunities on a global level. So digital revolution within health, it's been talked about for a while, AI being introduced, but it is now happening and it's accelerating very, very quickly. And we need to be there at the vanguard of this within Wales. Precision medicine is a very, very broad area, but this is where the diagnostic elements come in, and I'll touch on that just in a second. But precision medicine and advanced therapies, if we take those together, these are areas where earlier diagnostics, putting things in place that allow personalized medicine for people to be treated not as a cohort within a large population, but being able to target their treatment on a precise and personalized level can offer huge advantages, both to the patient, but also to the system in terms of efficiencies, etc. But these are massive, massive global markets where if we can deliver on our needs within the NHS for transition, which is essential that we do, but also use that opportunity to build up industry, etc. at the same time, then we're on to a real winner. Underpinning all of this as well, and it's an area where Wales is leading, is on the value-based elements of putting the patient first and looking at different models of charging, but bringing real value into the system. But that maybe is for another day, but it's a huge area where Wales is excelling. Next slide, please. Just trying to put this in context and a bit more detail from Ifan. So we have a Healthy Wales in terms of the policy within Wales, but key elements within their prevention. So prevention is a different way of thinking. We need to keep people away from the healthcare system because of the demands on it, but it's better for the patients, but it also opens up enormous markets as well. If you look at the prevention market globally, it's set to be bigger than the mobile phone market within the next few years. So huge elements in trying to think in those terms. Taking care closer to home, out of the health and care system, getting patients to be treated closer to home, so it's the whole diagnostic element area as well. Yet again, something that we need to do in Wales, but offers global opportunities. As you can see, maybe rather convoluted from this slide, those are the key elements of a healthier Wales. The impact areas feed into this, but the underlying elements of this is that prevention-based focus is a different way of thinking, a different culture, but recognizing that that is a system change that is happening around the globe and is offering up new markets, opportunities. So if we can accelerate and build on the system within Wales, we can then transfer and transport this into economic opportunities outside and beyond. Next slide, please. Ifan mentioned in terms of strengths, just across the CCR region, this is a bit of a high-level mapping. If we delve a bit deeper into this Google map, which we've constructed, there'd be a lot more companies, but this is giving a flavour. So you can see there are a number within the region of companies that would be counted as more traditional life sciences of 50 million plus turnover, and a whole range downwards then of SMEs, spin-outs, etc. from universities. But there is an existing ecosystem, there's an existing cluster in place. It's bringing this together with some focus, and that's what the challenge is quite exciting here, is providing that opportunity for all these partners to come together and to work together to deliver both for our healthcare system, but also that economic element as well that we've got to remember all the time through the Challenge Fund that's been offered as an opportunity. Next slide, please. Just very, very quickly, this is me throwing my 2 pence in terms of themes to think of maybe for the Challenge Fund, just to frame some discussion for later on. But earlier diagnostics, if you've been able to listen to BBC Wales today, you will have seen Tom Crosby, the cancer lead for Wales, espousing the importance of earlier diagnostics for cancer care within Wales. It's a big transition that needs to happen, certainly with the backlogs that are in place now with COVID, but offer opportunities from within Wales to export that expertise, knowledge, and products worldwide. Digital prevention, so that is very much bringing that digital elements of data, etc., and looking at population elements, but with a focus on preventing health, not treating, which is a huge area. And then the One Health element is acting as one system, but also looking at elements of sustainability. Protecting the environment leads to better health. It's the whole looking at social determinants of health, in that this isn't a monopoly from the NHS, from care homes, from pharmaceutical companies. This needs to bring communities together, sectors together to work on these challenges to really deliver value. So hopefully that's just a bit of a whistle-stop tour of what we do at the Hub, but also some of the landscape with a bit more detail. But hopefully just to provoke some discussion later on in terms of ideas and suggestions of themes for people to bring forward as challenges, but in particular to highlight that for the CCR challenges, the real value will come from partners coming forward together with challenges rather than single health boards or single providers. It's working in the background to bring people together, and we'd be delighted to be involved and to support that work with the CCR team to make sure that the opportunity that this Challenge Fund presents is really maximised to ensure that we do accelerate and we succeed within Wales. So thanks very much.
That's great, Rhodri. Thanks very much indeed. Thanks both for the presentation and for those comments there at the end in terms of collaboration. That's greatly appreciated. We've got a couple of questions in the chat for Ifan, and in fact, Rhodri, you touched on this in your presentation, so I'll invite you to comment too. So the first question I'll draw attention to is from Karen, and her comment is the challenge is regarding health and well-being, but she'd like to hear a bit more about preventative health care and well-being outcomes, and wondered whether Ifan could share any examples or his thoughts on ambitions for data development and solutions in that field, please. So Ifan, and then if Rhodri, if you want to build on the comments you made towards the end of your presentation, also on that preventative point, that would be welcome. Thanks.
Yeah, so I don't think I've got an easy or a fully formed answer. So a story and maybe an example from another sector which we can reflect on. So the story is when I first moved to the health department about a year after, Ruth Hussey started as the Chief Medical Officer. So she's the predecessor to Frank Atherton, who's now the Chief Medical Officer. And I said, oh, hello, I'm Ifan. Maybe I was in the economics department at the time. I said, I'm all for innovation. I really like, innovate industry, working with the NHS and great stuff like that. What can I do to help you? And she said, and like most of our chief medical officers in Wales, she's from a public health background. And she said, well, I really want to focus on prevention, and I want industry to get stuck into preventative health and influencing behaviours and a focus on well-being. And I said to her, well, look, if you can help me to work out how we can properly account for things that haven't happened, things that would have happened on a counterfactual basis, in a way that would remunerate business, that we'd have the confidence to pay them for things that haven't happened, then I'll bring them stampeding to your door. But until we can get to that position, it is really very difficult to bring industry into the preventative space, because you are paying for the avoidance of something that may have happened, and so all of it is based on counterfactuals or on suggestions. And I think that's extremely difficult. Now, some insurers are doing that. I think it's much easier in an insurance environment. And part of that is because the NHS is a pay-as-you-go system. The NHS, the statutory duty of the NHS and all NHS organisations is to land the budget on an annual basis. Although in Wales we've got 3-year flexibility, it's forced to live in the moment, and that is the way that the NHS works, because it also works at sort of 98% capacity, and that forces you also to live in the moment. Companies like, I think it's called Vitality Points, Vitality, the insurance company, they effectively give you a no claims discount and incentives, or they give you discounts for lifestyle behaviors. So they'll give you a Fitbit, and if you keep your steps above, then you'll get a reduction on next year's premium. If you go to a gym and you keep your weight below target level, if you go to a diet planner and you work through some healthy diets alternatives, all of these things add up into points that will reduce your premium for the following year. You can't map that model directly across into the NHS, because effectively, although they call it a no claims discount, in reality what it is a penalty for the people who've got poor lifestyle behaviors. And we're not going to get into a position where we start making people with poor lifestyle behaviors pay more for NHS services or pay for NHS services, whereas people who look after themselves don't have to pay. We're never going to get to that position. So we can't map that model across. But I think we can look at some of the behavioral science elements of that in terms of the way that we work. I think it's enormously challenging. So I would say that there is a lot more value for something like City Region, life sciences, medtech, etc., on early intervention rather than prevention. Earlier intervention for diagnostics in cancer, for example, lung cancer is a really clear example. Again, there's a company that is listing on AIM this week called Lung Life AI, and that is an improved cancer prognostic diagnostic company. It's not really, I wouldn't say, artificial intelligence. There's a lot of artificial intelligence bling going on. You call a company artificial intelligence and it moves you into the tech space, out of the healthcare space. But it is about earlier, more accurate diagnostics. And lung cancer in particular has very late presentation. And in Wales, we have real trouble. People don't present until they come to A&E. They don't present in primary care. But you do sometimes pick people up potentially on CT scans that they're routinely getting for other things. So I think the emphasis, I think prevention is really, really difficult for this space. But earlier intervention, which is also part of prudent healthcare and very clear in a healthy Wales, is a far more promising area. And you can get earlier and earlier and earlier until eventually maybe you get to an entirely preventative position.
Thanks, Ifan. I mean, that's an interesting challenge, isn't it? And Katie Palmer in the chat raised this corollary point around economic benefit on the one hand, but also being able to calculate cost savings for the public sector through prevention. And it seems to me, and this reminded me actually of some work that ERLAB did with its Innovate to Save programme. The challenge on demonstrating the economic benefits, whether they are value for companies and or cost savings for the public sector on some of these prevention initiatives, seems to me that if we're going to need to make the case in economic terms for some of these changes, then that's an area where we need some expert attention to be paid. Rhodri, do you want to come in on the prevention question, and then we'll probably move towards the next couple of presentations. But if there are any last questions for Ifan or Rhodri at this point, please do pop them in the chat. Rhodri?
I think it's the definition of prevention in a way. So if we look at prevention as a broader term, so my view of prevention is that there's 3 levels, and it is a recognised model internationally. So primary, secondary, tertiary prevention. So your primary prevention systems are tackling obesity, smoking cessation, population health type elements. Your secondary prevention, as Ifan says, is the earlier diagnostics. So it's really where digital AI, your precision medicine can really have an impact of that earlier detection of cancers or diseases, or being able to target through data, etc. So that's your secondary prevention level. Right up then to your tertiary prevention level of how do you prevent people with diseases of today from progressing to comorbidities, etc. Right through to weird and wonderful feels like augmented sort of reality elements, etc. So there's a recognized system. So prevention, maybe we need to not think of in terms of only that primary prevention element. But if we really did adopt prevention through the whole system, then there's different levels of prevention and huge opportunities at each of those levels to bring forward. On the question on the food element, yes, that's an important element in terms of the primary prevention element. Internationally, I think it's what 2% of health budgets are spent on the prevention element, so that needs to be addressed. But the difficulty in this is measuring that output and also recognizing that it is an investment, so it has to come from somewhere, but the returns sometimes are only seen in the longer term. So it's not as immediate as, operating on somebody today, that it could be 10, 20 years of investing in earlier childhood experiences, etc. And it is framing the system so those investments can be put in place, but it does offer huge opportunities for companies. Last week I was talking to a company who have developed some technology for body mass index, by looking at screens and doing some AI stuff. And there is a lot of work in place. I know we've had discussions with Ash Cymru on looking at some digital sort of solutions for smoking sensations as potential challenges here. There's a lot of these elements that can be put in place that deliver the health benefits, but also recognizing that there's economic, commercial opportunities in these areas where we can develop these products or systems within Wales and then export them. This is, a global challenge that is going on. So I'd caution about thinking that prevention is not a commercial opportunity. It is hugely so.
Thanks, Rhodri. I'm going to invite Ifan to make a couple of final comments, if he will. And picking up on a question, Ifan, that was in the chat a little earlier, Kevin asked about the implications of this shift that you described from science to technology. And then any final comments you'd like to offer to us before you have to leave. Thanks.
Certainly, Rick, thanks. And let me answer, these are personal comments. I'm not speaking on behalf of Welsh Government. It's a formal policy position here, okay? So don't quote me. I know I said ambitious, but you need to be focused as well as being ambitious. So I think the challenge with behaviours, social determinants, public health, smoking, diet, obesity, exercise, is that these are enormously challenging, boil the ocean type things. And I think there are questions as to the extent to which they're amenable to digital and to technology. And also, in some cases, they're quite well served by the market. Weight Watchers has existed for decades, and there's no point in us trying to create a direct competitor to Weight Watchers, which is publicly owned. There are initiatives. I think there's room to explore social prescribing. It's definitely a huge concern for government, and it is a concern for ministers. But for the challenge fund, which is, it's millions, not billions, I think a tighter focus is needed. So be ambitious, but not holistic. Otherwise, we're boiling the ocean and we won't be able to move. The shift from science to technology, it's easy for me to say this because I'm not in a university. But if I was in the universities, I'd be embracing this as a real opportunity. It's part of what certain universities, several universities, were initially founded to do, was to impact upon the real world. In Wales, Swansea originated out of the iron industry and the coal industry that was next to it, strong emphasis on engineering. Two of the top five global universities are MIT and Caltech, both technology-oriented institutes. And I think Britain has had a very strong science-oriented academic sector, an extremely successful and globally impactful science sector, but technology is really important because you can come up with the best thing in the world, and if you can't translate it into something that can be used, that it doesn't actually have any impact or benefit if it's in the theoretical world. So that's absolutely not to say that we should stop doing science. We want to increase R&D across the UK. As a whole, it's much lower than the 2.4% OECD average at the moment. It's a goal for the UK government. So I'm not anti-science. But I really want to see more technology, and I would say this in my role, but I think just personally sort of quite practically oriented and keener on tools and things that have demonstrable utility. Apart from anything else, I think also that gives you a far faster loop to impact. You can make changes in 5 years and see the evidence of that out in the system. And it's really welcome to see in Wales the University Health Board's agenda. Cardiff University has partnered with Cardiff and Vale University Health Board and with 2 other health boards. So health boards as well are trying to move into more of this space. And then finally, EKF. EKF does manufacture in the UK. It's got over 100 people employed in a factory in Penarth. They manufacture all of the COVID lateral flow tests that Amazon distribute to their own workforce and across the UK. that said, I think we've got to be very targeted about the areas in which we compete. We've had we've had one large Innova Medical partnering with Sharps. I think it's Innova, isn't it? Rhodri can nod or not. It's Innova partnering with Sharps. Hundreds of people employed, but these are these are low salary roles, right? They're below £20,000 per head on bulk manufacturing. It does not bring R&D and applied technology development with it. So where's the value point in these technologies? I think there's more opportunity. If you look at many of these listed AI companies, they have centralized labs. So in the US, they would have clear approved labs, but in the UK, we would have MHRA or other approved labs. They centralize that processing, but that's high value. The teams are tens of people, not hundreds and thousands of people, and they consolidate that processing to protect their IP and their know-how, as well as the patents that they have, but also then to flex further innovation on top of it. I think that's the route through. I would far rather have 10 of those. That's not the direction that our inward invest in Wales has historically gone. We've tended to go for large numbers of jobs, tending to be at lower value, tending to be in mature industries. It's a different thing, but city regions are a different thing. The Challenge Fund is a different thing. So it's very much about the future, not about what we had in the past.